Hi, I'm Kyle Anderson, and I'm going to talk about catastrophic thinking in chronic pain patients. And right from the practicalpainmanagement.com website, it says, because pain catastrophizing and fear avoidance can be related to negative therapeutic outcomes, clinicians need to be aware of these behaviors in clinical setting. So what exactly is pain catastrophizing? Just as it states, pain catastrophizing can be defined as an exaggerated negative orientation towards actual or anticipated pain experiences. We'll obviously be focusing on pain-related catastrophizing, but just to put it out there, obviously there's non-pain related, and some of the most common ones are listed below on this slide, such as losing control of oneself, spiraling into deep depression, um, intense feelings of loneliness, and rejection are all common types of catastrophization that are non-pain related. And one of the biggest frustrations for people who are undergoing chronic or suffer from chronic pain is the fact that often providers that are not familiar with catastrophizing feel like it's in their head. So catastrophizing can be thought of as the inverse of coping. And although it's not a good strategy, it's one that we need to be familiar with. And in Melzak's textbook of pain, on page 260, there's a nice table 18.1 shows the difference between someone who copes and someone who catastrophizes. According to ArizonaPain.com, it was first named in 1962 and then defined by Aaron T. Beck in 1987, and basically a maladaptive cognitive style, which gives people a very negative outlook on the future. In Melzak chapter 23, it refers to a 13-item catastrophizing scale that had 3 subscales, and that's the rumination, magnification, and helplessness. This is referred to on many other websites also, and I will talk a little more about it later. Dr. Michael Sullivan from McGill University developed the pain catastrophizing scale in 1995, known as PCS, and it's probably the most widely used scale to this point. So according to a Swedish study, patients with chronic musculoskeletal pain, the females tend to catastrophize more readily than the male, but then looking at a whiplash study showed that males tend to more anxiety disability. So it depends what study you're looking at, I guess. So pain in pediatrics, according to Melzak, the exact role that coping plays in pain in children and adolescents is not clear, but coping measures may be particularly useful in developing the focused cognitive behavioral interventions. And basically, Melzak stated also that children learn about pain according to how their parents cope or react to their pain. Pain catastrophizing in the operative setting will obviously lead to patients with increased pain post-op, and also patients developing chronic pain. They're more likely if they catastrophize. And then just a poor quality of life and harder to control pain. The interesting thing about PCS is it can be used on patients that are not suffering from pain. So it's a good way to assess and evaluate patients and identify them before they go through surgery. And so maybe they can have help, psychological help before. Probably the most difficult thing about a patient who catastrophizes or is in a pattern of catastrophizing is to make them aware of it without insulting them. This is very difficult, and they just need to know that there's being an unpleasant situation isn't always a catastrophe. Understanding that goes a long ways. Mindfulness meditation is a technique whereby the meditator learns to accept what is happening without judgment, interpretation, or analysis. Those who experience pain catastrophizing often experience their pain in terms of the future and how it will affect them, not in terms of what is occurring in the present. According to Melzack, the exact role that coping plays in pain in children and adolescents is not clear, but coping measures may be particularly useful in directing the focus of cognitive behavioral interventions. So in this situation, avoidance can actually be a good thing. For example, when negative thoughts arise, not acknowledging them may take away the power of negativity and help the individual gain a sense of control over their fears and even their pain. One of the most interesting ways I think that um, helping people have a more positive outlook is using a gratitude journal. So basically, they list out a whole bunch of things they're grateful for, and when they're in kind of that catastrophizing, they can go back and look at it, and then they have a whole list of positive things that can help redirect them. It's important to let our patients know that they can seek help. We're obviously a great resource to steer them in the correct direction. Obviously, hopefully they have a good friends and family network, and if they don't, we need to somehow provide some type of um, network for them um, and get them out of that negative outlook on life. So in conclusion, those who experience pain catastrophizing tend to amplify this pain and tend to feel helpless in the presence of pain, and even the thought of being in pain can make them feel helpless. And as providers, we need to be able to discuss with people and actually help them to see that what catastrophizing is and how the negativity affects them so they can have a more positive outlook in life. Thank you.